It's time to describe the neurotransmitters in the nervous system. The most popular and very well known neurotransmitter is acetylcholine. And acetylcholine is capable to act in two different ways. Most of the time is acting as excitatory. Excitatory in some areas of the central nervous system, obviously is the neurotransmitter by excellence for the parasympathetic nervous system, either in the ganglia or in the synapses with the organs. But also is the most popular neurotransmitter used to innervate the skeletal muscles. In some other cases, acetylcholine is inhibitory, and specifically in some specific autonomic motor neurons, specifically the parasympathetic, as I mentioned before. Now, the acetylcholine, that is a molecule used as neurotransmitter stored in the terminals of the neural terminal, they can match with two different receptors. One of the receptors are called nicotinic acetylcholine receptors. And these nicotinic acetylcholine receptors are always excitatory. Keep in mind, nicotinic acetylcholine are always excitatory. And they are found basically in what I mentioned before, within the motor end plate of the skeletal muscle cells. What is that? It's the postsynaptic cell in the synapses between the motor neuron and the skeletal muscle cell. This motor end plate become the postsynaptic cell of that famous skeletal muscle cell. Is in that cell membrane facing the cleft where we have that nicotinic acetylcholine receptors, and they are always excitatory. But also are found in all the ganglia of the autonomic nervous system, either for the sympathetic or the parasympathetic, and also in some areas of the central nervous system. The other type of acetylcholine receptor is called muscarinic, and that muscarinic receptors are found in the central nervous system and plasma membrane of smooth and cardiac muscles, and also glands innervated by the autonomic motor neurons. What is remarkable about the muscarinic acetylcholine receptors is in some cases are inhibitory, like for example in the cardiac muscle cells. But in another cases, the acetylcholine bounding with the muscarines act as excitatory reaction. For example, in the digestive system, because or also the urinary system, because that muscarines are very spread around and very common to be found along the digestive system. Basically, the digestive system is stimulated by the parasympathetic nervous system. Also, the respiratory system is stimulated by the parasympathetic, and also the urinary system is stimulated by the parasympathetic nervous system. So not always parasympathetic is associated with diminishing of the function. In some cases is stimulating. I mentioned before that the receptors that are located in the postsynaptic cell, in general in the central nervous system, is another neuron. Those channels are called ligand channels. In general, they are called ligand channels, and they are always associated with the conjugation of the proper neurotransmitter. In case of the acetylcholine, that two channels are nicotinic or muscarinic. And based on how they act with the neurotransmitter, they trigger a secondary action after they bonded with the neurotransmitter. That's why we organize these channels also in another two categories. One are called ligand-gated channels, the other one are called G-protein coupled channels. But keep in mind that either the ligand or the G proteins are considered ligand channels. There is a little difference between ligand and G proteins, and let me explain why. In case of the nicotinic channels, and I want to continue just not talking about ligand or G protein coupled channels. I'm going to continue just talking about nicotinic or muscarinic. Both are ligand channels. Now, what happened with the acetylcholine match or bind with the acetylcholine bind with the nicotinic channel? That channel is not only a receptor, is also a channel that can be open or closed, and when it's activated, open and allow sodium to get into the cell. Also can allow potassium to leave the cell. But they are more common allowing sodium to get into. Now, based on that, if we allow sodium to get into, what is happening is the cell, the postganglionic cell, is depolarized. And is what happened in the skeletal muscle cells, basically. This one is the action. In this graphic, you can visualize the action of the nicotinic receptors when they bind with acetylcholine. If you notice, in the outer part of the cell membrane, that receptor, nicotine receptor, has a niche for two molecules of acetylcholine. When acetylcholine binds with this particular niche, that channel is open. That one is the characteristic of the nicotinic receptor. It's a channel, it's a receptor, and is a channel itself that can be open or closed. Acetylcholine binds with that, and immediately sodium gets into. You have to be clear that sodium and potassium, they are always in opposite direction. However, in this case, it's more sodium that is getting into the cell than potassium getting out of the cell. And this concept is based on the electrochemical gradient. By chemical gradient is not easy. By chemical gradient, it's easy for potassium to get out because the potassium moves from higher concentration to lower concentration. But the electrical gradient for potassium is not in favor because most of the cell outside is positive. However, for sodium, is wonderful to get into based on both electrical and chemical gradient. That's why it's more sodium that gets into than potassium gets out. When there are more sodium get into the cell, produce the famous excitatory postsynaptic potential. And it's another example of a graded potential because it's happening in the postsynaptic cell. This graphic must be familiar for you because I mentioned before that the graded potentials are capable to be added together. So when you have several excitatory postsynaptic potentials, graded potential with different intensity, they can be added together. If we add together the intensity of 1, 2, and 3, like you see in this graphic, eventually they can run through the body of the neuron and reach the hillock. And if they hit the hillock with at least minus 55 millivolts, bingo, you have the origination of an action potential that will run through the axon. And remember, is starting in the first segment. And from the first segment is passing to the second, to the third one, and all the segments until they reach the terminal with the same intensity. Action potentials are all or none, but graded potentials are decremental. The other type of acetylcholine receptor are the muscarinic, and muscarinic with acetylcholine can be excitatory, can produce an excitatory reaction or an inhibitory reaction. In this case, when muscarinic receptor bind with acetylcholine in the sinoatrial or atrioventricular node of the heart, produce an inhibitory reaction by which the heart rate is diminished, is reducing the heart rate or reducing the heartbeat. Acetylcholine binds with the receptor, but the receptor is not a channel, it's just a receptor. However, this action triggers the other molecule on the inner side of the same receptor, muscarinic receptor, that is the G protein, and produce the dissociation of the G protein. When the G protein is dissociated, travel through the cell membrane, the inner part of the cell membrane, and bind with the receptor nearby. In this case, the receptor is a channel. And when that happens, the channel open and allowed potassium from inside the sinoatrial or atrioventricular node to leave the cell. Based on the previous knowledge that you acquired, if potassium positive ion leave the cell, that inner part of the cell become more negative, more negative, more negative, until become hyperpolarized. And this one is inhibitory reaction, means that sinoatrial is not capable to trigger another action potential with the normal rhythm of that heart, is reducing the heart rate. Therefore, as a summary, we can just mention that acetylcholine with muscarinic receptor produce either an excitatory or inhibitory action, postsynaptic potential. As a sample of inhibitory postsynaptic potential, we mention in the heart, and as action of the as an excitatory postsynaptic potential is the action of the parasympathetic, for example, within the digestive system that stimulate the digestion. In the case produce an inhibitory postsynaptic potential, produce a hyperpolarization in the cell that is affected. In the case of excitatory postsynaptic potential, produce a depolarization in the cell that is affected. The cell is always a postsynaptic cell. The muscarinic receptor also is used for other type of neurotransmitter. In this case, is the norepinephrine neurotransmitter. Norepinephrine neurotransmitter. When the norepinephrine binds with the muscarinic receptor, and this one is another sample that they also happen in the heart, because this one is the action that, or how the sympathetic nervous system is acting in the heart. Norepinephrine, that is another type of neurotransmitter specifically used by the sympathetic postganglionic neuron, in this case when is innervated the sinoatrial node. In this scenario, norepinephrine binds with the muscarinic, and as I mentioned before, muscarinic is never a channel, is only a receptor, but is always associated in the inner part of the cell membrane with a G protein. By the combination of the neurotransmitter norepinephrine with the muscarinic, trigger that G protein to be dissociated. By dissociation, that G protein dissociated travel in the cell membrane to a different steps. The final steps of that G protein is producing the opening of a channel, an opening of the channel. In that case, that channels allow basically the sodium get into the sinoatrial node, and by doing so, produce a depolarization and increase the heart rate. Muscarinic not only can be associated, the muscarinic receptor not only can be associated with just acetylcholine. Muscarinic can be associated also, or can be a receptor for other type of neurotransmitter. In this case is the norepinephrine. But certainly what is a common denominator for muscarinic is, regardless what is the neurotransmitter that this receptor conjugate with, there is always this receptor is always associated with the G protein in the inner side of the cell. G protein is a secondary messenger. The neurotransmitter by itself is the primary messenger, and the G protein is acting like a secondary messenger. This G protein is dissociated and is traveling through the inner part of the cell membrane. Eventually, not just in the first step, probably in the second step, but eventually is triggering the channel nearby to be open, and there are molecules that can be getting into or getting out of the cell through this channel. And the effect in general, when norepinephrine is the neurotransmitter, in general, most of the cases produce an excitatory postsynaptic potential. After the neurotransmitter is released into the cleft, whatever is the neurotransmitter, regardless what type and what name, the neurotransmitter, the excess of neurotransmitter, need to be removed from the cleft to clear the electrical conduction. In case of the acetylcholine neurotransmitter, there is in particular one molecule, one enzyme that is in charge to dissolve that particular acetylcholine neurotransmitter. This enzyme is acetylcholinesterase. This enzyme is in charge to pick up the acetylcholine molecules, and is the function of the enzymes to, that one is the substrate. The substrate is acetylcholine molecule. But using this enzyme, acetylcholinesterase, that acetylcholine is breaking into molecules, acetate and choline. Acetate and choline goes back into the presynaptic neuron. Inside the neuron terminal, that acetate and choline are going to be reconverted into acetylcholine and stored again in the vesicles at the neuron terminal. Is another way not only to dissolve the excess of acetylcholine in the cleft, is also a mechanism to recycle the same product. To reinforce the action of acetylcholine in the parasympathetic nervous system, we also mentioned before that is the neurotransmitter used by excellence, is the most abundant neurotransmitter, but also is the only neurotransmitter used to innervate the skeletal muscles. And the combination of acetylcholine plus nicotinic receptors produce an excitatory postsynaptic potential in the skeletal muscles. Acetylcholine is also, there are certain drugs specifically that can neutralize or inhibit or blocking the acetylcholine receptors. And there are drugs in the positive way, there are drugs used in the negative way. Curare is a poison. If the person was injected with curare, that particular drug is inhibiting, blocking the acetylcholine receptors and paralyze the muscles, so the muscles cannot contract. If we are talking about the skeletal muscles, imagine that one of them is the diaphragm. If the curare paralyzes the diaphragm, we cannot breathe and we die. But there are another positive way to use that particular drugs, not specifically curare, but eventually they can produce not blocking completely the acetylcholine receptors of the skeletal muscles, but eventually they can block some of them, no other one, and produce an effect of muscle relaxer, like for example Valium, that is most popular, most not addicted drug that produce muscle relaxation, that is prescribed for people who have severe muscle contraction or chronic pain for muscles, different kind of indication. The secondary effect of this action is reduce the anxiety, because when the muscles are relaxed, the person reduces the level of anxiety. Even when it's not a drug, Valium is not a drug for reduce the anxiety, the secondary effect of the muscle relaxation produce certain kind of relief for people who suffer anxiety. But there is another disease, the Alzheimer's disease, that is associated with acetylcholine. There are specific neurons in the specifically in the midbrain of the brainstem that they are associated. They produce these neurons produce acetylcholine as a neurotransmitter, and they use it as a neurotransmitter, means is a messenger. However, for theories that are under investigation but very related to the production of pathological protein in that neurons, eventually by production of this abnormal and foreign protein from that neurons intoxicate the neuron, and the neuron die. If the neuron die, cannot be reproduced, and if the neuron die, cannot produce acetylcholine. These neurons in that particular area of the brain, in the midbrain, are associated with memory, and losing the amount of acetylcholine in this area, obviously the person is affected with the memory. That is the initial step of Alzheimer's disease that eventually can kill the patient, but is a very chronic degenerative disease that I'm pretty sure all of you are aware about it, but this one is how it starts. Certainly, acetylcholine is the most abundant and most common, very well-known neurotransmitter. Also, norepinephrine is a very popular neurotransmitter as well. However, they are not the only one. We have another characteristic or another classification of neurotransmitters that are called monoamines neurotransmitters. And in this category, or in this classification, we have samples like, for example, dopamine, norepinephrine that I already mentioned. The norepinephrine is the most popular monoamine neurotransmitter. Dopamine is the other one, epinephrine is the other one, serotonin, histamine. All of these ones are neurotransmitters. I want to emphasize that several of them, monoamines and amines, is part of the, they are like siblings of amino acids and polypeptides and proteins, but these ones are monoamines. Some of them certainly you know them from different other sources. However, we have histamine that is produced by the mast cells, serotonin that is found in the platelets, epinephrine and norepinephrine that is produced also in the renal medulla, and the list continues. So keep in mind that when the neuron produces that molecule and its storage in a vesicle is a neurotransmitter, and is a neurotransmitter produced by this neuron. It doesn't mean that our body doesn't have another places where they use the same molecule and is produced by other cells, different cells. But certainly, like acetylcholine, the monoamines, any of those, need to be removed from the cleft. exactly like acetylcholine. Acetylcholine is using the acetylcholinesterase, and the monoamines are using MAO, MAO, that is called monoamine oxidase. And this enzyme is the one used by excellence by this type of monoamines neurotransmitters to be removed from the cleft. Therefore, any monoamine neurotransmitter is released in the same way like any other neurotransmitter. Is by the action potential that reach the terminal, trigger the opening of the calcium, the voltage calcium channels. Calcium gets into the terminal and trigger the fusion of the vesicles, push them to the cleft and release by exocytosis. When it's released in the cleft, that monoamines are always swim or try to navigate into the cleft until they reach the other part of the cleft when there is a postsynaptic membrane. And in the postsynaptic membrane, there are the receptor for specific for any kind of monoamine neurotransmitter. But the excess of neurotransmitter released in the cleft need to be removed, and the enzyme used to remove them is the MAO. Serotonin is certainly another monoamine neurotransmitter. Serotonin is very associated with the mood, behavior, appetite, and cerebral circulation. There are certain drugs that are producing an antagonist effect that with serotonin, like for example LSD, that is an illicit drug, but there are another hallucinogens that also produce an antagonist effect than serotonin. And serotonin, what is the action of serotonin? There are certain medications to treat depression, like Prozac, Paxil, Zoloft, Wellbutrin. The list is really very long, but certainly these drugs, what they are doing is inhibiting the removing of the serotonin from the cleft. By a very common chronic disease that is called stress, eventually can trigger a depression. Not necessarily have to be a depression for schizophrenia, bipolarity, or ADHD, or there are different types of depression. But certainly, all of them are associated with the serotonin. Now, serotonin can be in lack of production by the neurons produced by stress. The effect of stress in a chronic stress affects the production of serotonin. Another effect of the depression is how long that serotonin lasts in the cleft. So that medication is always related to the amount of serotonin production, the amount of serotonin in the cleft, how long they last in the cleft, but it's always related with the serotonin. Now, regardless what type of depression the patient may develop, it doesn't matter if that depression is coming from loss a loved one, or a grieving, or a divorce, or lost a job, or shelter in place that we have in these days, or a disease by itself. Could be bipolarity, or ADHD with depression, or schizophrenia. There are really large variety. When the patient develops a depression and is in a very deep state of depression, it doesn't matter what is the name of this depression. The patient is treated in the same way. I mean, all of us, we are different, but how the doctors treat a depression is basically using the same tools. Is also targeting the serotonin production. But also there are different drugs specific serotonin that target specific serotonin receptors that are targeting the anxiety, appetite control, and migraine headache. So there are different medications not only for depression but also for appetite control, anxiety, and other kind of disorders, but always related with the serotonin production. All the neurons that use acetylcholine as a neurotransmitter are called cholinergic, and the neurons that use dopamine are dopaminergic neurons. And they are highly concentrated in the midbrain. As I mentioned before, the midbrain is the first part of the brainstem, the top part next to the diencephalon. And they are associated with the emotional, with the mood, with anxiety, and different kind of emotional status. But there is another disease we mentioned about before, about the Alzheimer's disease and how the Alzheimer's is related with acetylcholine. Now, there is another mental disease that is called Parkinson's disease that is not related to the production of the neurotransmitters, is degeneration of the neurons that produce the neurotransmitter, and this one is Parkinson's disease. Those patients can be treated not only with L-dopamine and MAO inhibitors, means that they are related to the stay longer the action of the dopamine in the cleft. Norepinephrine is a neurotransmitter that is used not only in the central nervous system, is also used in the peripheral nervous system. Now, the sympathetic neurons, the postganglionic sympathetic neurons, are using always norepinephrine as a neurotransmitter to innervate muscles, cardiac muscles, smooth muscles, and glands. The sympathetic neurons use another neurons in the central nervous systems are using norepinephrine as well as neurotransmitter. The amphetamines that are very popular, amphetamines work by stimulating norepinephrine pathway in the brain. If you are familiar with amphetamines, you are aware that amphetamine accelerate the metabolism of the cells. And yes, that person get more focused, but also the whole physiology is accelerated. The person who is taking amphetamines, probably you are very young, but was right now is very regulated. But years ago, during the 70s and 80s, amphetamines were not regulated, and many people use it abnormally to stay awake, to work longer, to have higher stamina, and basically many women were using amphetamines to lose weight. However, amphetamine is very risky if it's taken without a medical control, because accelerate too much the heart rate in the way that if the patient is taking amphetamine without control, they are at risk to have a cardiac arrest, basically, or a heart attack. So they have to be taken with control. And taking with control is a medication used to treat, for example, ADHD, that if the patient has the learning disability and problem to be focused, not all of them, but some of them are taking medication to be focused during at least 6 or 7 hours during the day that allow them to be concentrated and not distracted. Is one of the uses, is they are using for other purposes, but this one is the main purpose that amphetamines are used for. But all, as I mentioned before, need to be taken with a medical control. I mentioned about the acetylcholine neurotransmitter, the amines, monoamines neurotransmitters, but there are also another neurotransmitters that could be amino acids, glutamate, polypeptides, peptides. However, I want to mention about one in particular that is called GABA. GABA is the most popular, most common inhibitory neurotransmitter in the central nervous system. So the action of this GABA is opening chloride channels to get into the cell, and by doing that they produce an inhibition. So GABA is the most common inhibitor neurotransmitter in the central nervous system. Yes, GABA receptors are specifically for this molecule, and certainly the receptor is also a channel. When the neurotransmitter GABA conjugate with the receptor, that receptor open and allow chloride get into the cell, producing an inhibitory postsynaptic potential.